researchers from Skoltech, Russia, have developed an early prototype of a medical imaging system that uses neural networks to analyze near-infrared images of veins and project a venous pattern onto a patient's body. This may make blood draws much easier and less of a nuisance for patients with difficult access to veins. The paper was published in the proceedings of the 16th International Conference on Control, Automation, Robotics and Vision. According to data cited in the paper, out of approximately 20 million blood tests performed globally every day, almost 45% are estimated to involve some degree of discomfort for the patient whose veins are harder to access due to medical conditions such as diabetes, a particularly young age, or simply individual characteristics of the body. In these cases, when veins are hardly discernible and non-palpable, even experienced medical professionals have to turn to technical aids or risk multiple or inaccurate punctures, which can even have health consequences, especially for older adults. The Skoltech researchers decided to assemble an intelligent near-infrared vein scanner, which can determine vein contours in an arm or a leg quite accurately, fully automatically, and independently without any input from the user. They did so by using artificial neural networks and reinforcement learning to better analyze the images and project them back as a visual aid onto the patient's body, adjusting for its shape and position. Infrared vein scanners have become commonplace in clinical practice. However, this is the first one that does everything entirely by virtue of modern AI. One neural network cleans and processes the infrared signal. The second one detects contours of the veins. And the third one continuously worries about alignment to assure the contours projected to a patient's arm overlap with the actual veins. The researchers say that all they had to do was to tell the system what is good and what is bad during the training stage. And the neural networks managed to learn the rest by themselves, automatically finding optimal settings for new patients, environments, and even disasters, even if the system has never encountered them. The team assembled a prototype device and tested it in experiments with volunteers, showing it was able to detect the venous pattern in the near-infrared spectrum and then project it back as an image onto people's arms. A blood test performed with this device would look like this. The patient puts her arm under the device, which immediately searches for veins in less than a second and projects them over the forearm. If the patient moves the forearm, although the researchers do not recommend it during a blood test involving needles, the system will immediately start the realigning procedure.